Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Have you heard the buzz about Ozempic babies? It's kind of a surprising term popping up in headlines.
It is, yeah. It suggests this unexpected connection, doesn't it, between popular weight loss meds and unintended pregnancies.
Exactly. So today, we're diving deep into that interaction, specifically between these newer, highly effective weight loss medications. We're talking Wegovy, which is Semaglutide, and Mounjaro, that's Tirzepatide and oral contraceptives.
Right. And this isn't just, internet chatter. The UK's medicines regulator, they've actually issued guidance.
Really?
Yeah, because of a growing number of reports of unintended pregnancies. It highlights a very real-world concern.
Okay, so it's serious.
Definitely. So our mission today really is to unpack the science behind this, understand what's truly happening, and crucially, what it means for you if you're using these medications.
And we want to tell you exactly what you need to know, to stay safe and informed. We've pulled insights from a recent health news article and a pretty comprehensive scientific review.
That's right, published in the Journal of the American Pharmacists Association.
Okay, good sources. So let's dive in.
Let's do it.
So maybe start with the basics. How exactly do these weight loss injections like Semaglutide and Tirzepatide actually work in the body?
Okay. Well, they're quite ingenious, actually. They essentially mimic hormones our gut naturally releases after we eat.
Oh?
So semaglutide primarily acts like one called glucagon-like peptide 1. Tirzepatide, though, it's a bit different. It's a dual actor.
Dual act.
Yeah, it mimics both glucagon-like peptide 1 and another hormone system called glucose-dependent insulinotropic polypeptide. And both of these hormones, they work to suppress appetite. That's a major factor for weight loss, obviously.
Right, appetite suppression. Makes sense. But what other mechanisms are at play? I mean, how else do they achieve their effects beyond just making you feel less hungry?
That's a great question because their mechanism is, multifaceted. So one thing is they inhibit specific regions in the brain associated with hunger, which helps counteract that, natural increase in appetite that often happens when people are losing weight. But, and here's where it gets really interesting for our topic today, they also significantly slow down how quickly food leaves the stomach.
Okay, gastric emptying.
Exactly, that process, gastric emptying. And that slowing down is the primary way these weight loss meds seem to interact with oral contraceptives.
How so?
Well, think about it. The active ingredient in many combined oral contraceptive pills, it's a synthetic estrogen called ethinylestradiol. It's mostly absorbed in the small intestine.
Right.
So if the pill takes much longer to leave the stomach and actually reach the small intestine where it gets absorbed, its effectiveness can be compromised. It's just not getting into your system as efficiently or maybe as quickly.
So we're talking about a real reduction in how much of the contraceptive actually gets into the bloodstream then? Do we have, specific numbers on that?
We do, yeah. There was a 2024 study looking at Tirzepatide specifically. It showed Tirzepatide reduced the total amount of that ethinylestradiol getting into the bloodstream by about 20%.
20%, wow.
Yeah, and it also significantly increased the time it took for that ethinylestradiol to be fully absorbed, anywhere from 2 to 4 hours longer than usual.
2 to 4 hours.
Yeah.
That sounds like a big delay.
It is. And this reduced absorbency, this delay, it directly affects the pill's ability to, suppress the reproductive system, so it impacts its effectiveness.
That's pretty substantial. Is there a difference, though, between how Semaglutide and Tirzepatide affect this? You mentioned Tirzepatide specifically there.
Yes, there is a notable difference that the research points to. While both drugs do affect gastric emptying, the study suggests the effects of Semaglutide on ethinylestradiol absorption were less pronounced compared to Tirzepatide.
Interesting. Any idea why?
Well, the exact reasons are still being investigated. But one study indicated that while both might slow gastric emptying similarly initially, the effect seems to be much longer lasting with Tirzepatide. And that prolonged effect seems to be a crucial part of this puzzle.
Okay, so the delayed gastric emptying is the main player.
Mm-hmm.
But you mentioned other factors might be contributing to these unintended pregnancies.
Absolutely. There are a couple of other important things to consider here. First, side effects.
Right, like nausea.
Exactly. Common side effects include vomiting that affects about 12% of patients taking Tirzepatide and diarrhea, which is around 23%.
Okay.
And these kinds of gastrointestinal issues, well, they can interfere with the absorption of any oral medication, not just contraceptives. If the medication is expelled from your body, through vomiting or diarrhea before it's had a proper chance to be absorbed.
It won't work as well.
Precisely. It's kind of an unfortunate double whammy for oral contraceptives, isn't it? This is why people on birth control are usually advised anyway to use backup contraception after episodes of vomiting or severe diarrhea.
That's a really important point, which actually leads us to another potential factor, right? The bigger picture of weight loss itself.
Absolutely. You raise a key question. Could the weight loss itself be a factor? We know that obesity has long been linked to reduced fertility. It often exacerbates conditions like polycystic ovary syndrome, PCOS, which directly affects ovarian function. So when someone loses a significant amount of weight, even independent of their contraception method, it can naturally lead to an increase in fertility. Pregnancy just becomes more likely.
So it's potentially a combination of things, the drug interaction, the side effects, and maybe increased underlying fertility.
Exactly. It's likely a confluence of these factors for many individuals.
Okay, so we've got these different elements, but what does the scientific literature say specifically about the direct drug-on-drug interaction? Let's turn to that in-depth review you mentioned from the Journal of the American Pharmacists Association. How did they approach that study?
Right. So this was a systematic review. Their goal was basically to compare the impact of tirzepatide versus other similar drugs, these glucagon-like peptide-1 receptor agonists on oral hormonal contraceptives.
Okay.
They did this by meticulously analyzing the findings from 6 different clinical trials, trying to get a really comprehensive picture of the effect.
And what did they find? What were the key takeaways?
Okay, so here are the key findings, and this is where a crucial distinction really emerges. The review found that only tirzepatide showed a statistically significant reduction across several measures.
Like what?
Like the total amount of the contraceptive drug getting into the body over time, the highest level it reached in the bloodstream, the peak concentration, and a significant delay in how long it took to reach that peak level when taken alongside oral hormonal contraceptives.
Wow. Okay, so a clear distinction just for tirzepatide in that review. What about the other drugs in that class? The other glucagon-like peptide-1 agonists?
Well, the other 5 studies they looked at involving drugs like dulaglutide, liraglutide, and yes, semaglutide, they did not show a statistically or clinically significant difference in their impact on the oral contraceptives.
So no significant impact from those others.
Essentially, yes. And here's the critical point. While some of those other drugs might have shown some very minor changes in absorption parameters, those changes weren't considered substantial enough to actually affect the efficacy of the contraceptive.
I see.
But with tirzepatide, the decrease in that peak concentration, that was deemed clinically significant, meaning it could genuinely impact how well the contraceptive works to prevent pregnancy.
Yeah.
And that delay in absorption with tirzepatide was also substantial, sometimes 2.5 to 4.5 hours longer.
That's a critical difference.
Yeah.
So what does this all mean for why? Why is tirzepatide seemingly different from the other drugs in this class?
It really seems to come down to 2 main things. Tirzepatide's dual action, remember, it hits both those hormone receptors, glucagon-like peptide-1 and glucose-dependent insulinotropic polypeptide, and its unique dosing strategy.
Okay, the dosing.
Yeah.
How did that play in?
Well, that delay in gastric emptying seems to be most substantial right after the first dose of tirzepatide. Now, the body can adapt somewhat over time. There's a phenomenon called tachyphylaxis, where the response lessens.
Right.
But the way tirzepatide is dosed is key. Patients start low and then increase the dose every 4 weeks.
Oh, okay.
This dose escalation means that each time you take a new, higher dose, you can potentially get that significant delay in gastric emptying all over again. It makes the interaction with oral meds potent, potentially repeatedly.
Whereas the other drugs...
The other glucagon-like peptide-1 receptor agonists might also delay gastric emptying to some extent, but typically not to a degree that's shown to impact contraceptive efficacy in the same way. And notably, their manufacturers don't generally include specific recommendations for backup contraception like we see with tirzepatide.
Got it. Okay, so given all these findings, what's the practical takeaway? What should someone do if they're using oral contraceptives and they're either considering or already taking these weight loss medications?
The guidance is actually quite clear now. If you are using an oral contraceptive pill and you start either semaglutide or tirzepatide, the advice is to use an additional non-oral form of contraception.
Like condoms?
Exactly, like condoms. And you should do that for 4 weeks after starting the medication.
4 weeks after starting. Okay. And for tirzepatide specifically, you mentioned the dose increases. Does the advice continue?
Yes, that's crucial. For tirzepatide, because of that dose escalation schedule, the recommendation extends. You should use that additional non-oral contraception for 4 weeks after any dosage increase as well.
Right. Makes sense.
That's typically when side effects are highest and that gastric emptying effect is most pronounced again.
And just to clarify, this primarily affects oral pills, right? What about other forms of contraception?
Good point. Yes, this interaction is mainly about oral contraceptives because their absorption relies on the gastrointestinal tract. Other methods like intrauterine devices, IUDs, transdermal patches, implants, they're generally unaffected.
Because they bypass the stomach.
Exactly. Their active ingredients get absorbed into the bloodstream differently, independently of the GI tract. And of course, physical barriers like condoms or copper IUDs are also completely unaffected by these medications.
Okay, that's helpful clarification. Now, what about the situation where someone does become pregnant while taking one of these weight loss drugs? What's the advice then?
Yeah, that's an important scenario. Currently, there's a lack in clear evidence about the safety of these specific weight loss medications during pregnancy. So the standard advice is that women who become pregnant while using one of these drugs should speak to their doctor immediately.
To stop the medication.
Likely to discuss stopping it and finding alternative ways to manage their health during pregnancy. Yes, safety first.
Understood. So looking at the bigger picture here, you mentioned the research is ongoing.
Absolutely. It's vital to acknowledge that. Many of the studies reviewed were relatively short-term. So fully understanding the long-term effects, or say the effects once someone is on a stable, higher dose of tirzepatide for a while, that's harder to know right now.
Some more research needed.
Definitely. Future studies are needed to really pin down the precise mechanisms of interaction and understand any longer-term implications of using these medications, especially alongside other drugs.
So while we have some pretty significant insights now, particularly about tirzepatide, there's still more to learn.
Always. Science evolves.
Yeah. Well, this deep dive certainly reveals how medications we might think of as unrelated can have these surprising and frankly critical interactions. It's clearly not just about what a drug does on its own, but how it interacts with your body's basic processes like digestion and other medications you might be taking.
Absolutely. And perhaps this raises an important question for you, the listener, to consider. In this era where we have new treatments developing so rapidly, how proactive can you be, in discussing all your medications, all your health conditions with your healthcare provider? Just to make sure you really understand every potential interaction.
That's a great point. Constant communication with your doctor is key. Well, we hope this deep dive has given you a clear, more informed perspective on this really important topic. Stay curious, stay informed, and we'll see you on the next deep dive.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.